Good morning, everyone. Welcome back to another episode of the Scholars Table. Today, we are joined by one exceptional candidate who is currently a Sommer Scholar at the Johns Hopkins Bloomberg School of Public Health. He's an MD from Zambia and has a master's in project management. For quite some time now, I've had a couple of people reaching out to find out about the Sommer Scholars Program. How do you get into the Sommer Scholars Program, which is a highly competitive scholarship program at the Johns Hopkins Bloomberg School of Public Health, usually reserved for, I would say, 5 to 10% of the incoming class. So you can think of this as being the top 5 to 10% of a class of about 250 students. So if you really want to put in an application that stands out, that can earn you this type of scholarship that covers literally everything, this episode is for you. If you're new here, subscribe and turn on the notifications so you don't miss any of our future videos. Without wasting much time, I would like to introduce Dr. Murishi.
Thank you so much, Dr. Banda. Thank you for inviting me, and my greetings to everybody who is watching this program.
Awesome, awesome. I remember, meeting you a couple of during the orientation. I know you had reached out on WhatsApp, but I couldn't really respond. But when we met, you talked me through how the journey was like, how you single-handedly explored resources and applied to graduate school. So I want you to, share your experience with us, with viewers who are watching, who are also interested in applying to graduate school. But before that, I know you have a very fascinating background. But can you briefly introduce yourself, your home country, your professional background, and your medical specialty? Just keep it brief, okay?
Thank you so much, sir. My name is Onesphore Murishi. Of course, I'm from the Republic of Zambia. We call the real Africa. And I'm a medical doctor by profession. I've really practiced for a few years and I pivoted into healthcare management. So I became a hospital manager for one of the greatest, hospitals in town in Lusaka City called PHI Family Hospital, managed it. And of course, I didn't end there. I went on to study project management masters at the University of London. And I thought at this time around, I should look further into developing my career in terms of public health because right now, if I look at what's happening in my country and all over Africa and the world, public health has a very special place in health outcomes.
Okay. So, that's like an interesting academic profile. But, in terms of where you grew up, did you start from Zambia? Tell us something fascinating about where you grew up.
Wow. So I actually grew up from Zambia, but Zambia is a big country. It has got 10 provinces. So where I grew up from is northwestern province in a city called Solwezi. But further from that, very, very, very far in a rural area, a place without schools, nearby. In those years we had to travel for quite a number of kilometers for you to reach at school. And later, after many governments which exchanged, they were able to build schools. But in our time, we were actually I started school under a tree, within those regions. But I managed to really do my the efforts. I became a best student in my province and went further to study at one of the best medical universities in Africa, the University of Zambia School of Medicine, and here I am.
Awesome, awesome, awesome. That's an interesting journey, and I know many folks on this platform usually want to understand your experience with a graduate school application. You are a Sommer Scholar, which is one of the prestigious scholarships at Johns Hopkins University. I myself was a summer scholar some years ago, so I understand the gravitas of that award and what comes with it. So I want you to kind of walk us through your application experience. But for now, could you summarize what the experience was like for you? Could you walk us through the application process? So if someone was to apply to graduate school in the US, what are the main steps?
That's right. So first and foremost, when I wanted to apply for a school of public health, my first destination, of course, was to think, okay, USA, because what we know is the Western world or the Anglo-Saxon world has a certain consistent, educational system, which is quite good. And in Zambia, we love to to go to Anglo-Saxon schools. And of course, America is one that stands out in the Western world. So I went online, I searched for the top 5 schools of public health in the world. And Johns Hopkins Bloomberg School of Public Health came as top one. I actually got interested in knowing, is it just for the year I was applying, or is it for previous records? And actually, I discovered something very fascinating. Johns Hopkins had consistently been the number one school of public health, like more than 10 years, like since 1990s, counting to date. I say, this is my destined place. I have to go to this place. I didn't look any further. I tell you, I didn't look any further after seeing that record. I mean, like seriously, people have been holding a record of number one school of public health more than 10 times, 15 times. And consistently, you have to love that school.
Yeah, yeah.
So from there now, my first task was, what do I do? I'm usually a person who do not do things blindly. I look for data to support my decision. So I
Mm-hmm.
went on YouTube, to find out requirements for public health application. And I was very lucky that the first video that came was a video of you, Dr. Banda. You were doing some some YouTube video where you were talking about you getting into 3 school, is it some schools,
Yeah.
Johns Hopkins, Harvard University, and you are trying to give some ratings there. You are telling us why you decided Hopkins. I watched that. Next, I go to another podcast where you were talking about the statement of purpose. My
Mm-hmm.
goodness, that was God to me. I said, these are the things I want to watch. So I watched that webinar, or I don't know whether it was a podcast, and I
Yeah.
kept on seeing so many webinars you've done, how to apply on sofas, how to do West evaluation, and you literally became one stop center for me. Like all the materials I gathered for my application, I
Yeah.
literally listened to you alone. And the reason why I used your material is because you have comprehensive resources, step by step. Whatever an international student has to do, you
Yeah.
explain it. I said, this is what I have to do. So I actually followed everything you spoke. That's why when people reach out to me and say, all right, we want to be your mentees, take us through the process of graduate application for MPH, like public health studies, I tell
Yeah.
them, online, search Banda Khalifa. If you see this one, this is the person to listen to, not me. That's what I tell people. Because I literally have nothing to say. I used your materials. So I just refer people to your materials. And whoever is watching this, take what I'm telling you as some of the information, but go on YouTube, search Banda Khalifa. Go
Mm-hmm.
on LinkedIn, search Banda Khalifa. Again, if you do not watch his videos, you are you are you are going to find it difficult. So I now started gathering my materials. I started with the SOP because
Mm-hmm.
you mentioned in your videos that the SOP was very important, and I came to discover that it is the most important material, the statement of purpose. So I
Yeah.
sat down, listened to your structure, and I was just getting the style, the
Mm-hmm. Mm-hmm.
information somebody has to put in the SOP, and just how somebody should flow. I sat down, I started crafting my SOP. I was reading it to myself, and my question was, if I was an officer from Hopkins and I'm reading this SOP, can I be convinced to get this kind of person?
Mm-hmm.
I
Yeah.
gave my wife, I said, listen to this SOP. Does it feel convincing to you? She says, work on it a bit more. Listen to Dr. Banda a bit more. I come to listen to your SOP again. I tailor it to mine until I reached to the extent where my confidence had risen. And
Yeah.
when I was listening, I was reading that SOP, the opening statement itself. I could say, "This is good. This is good."
Yeah. It has
I
arrived.
knew
Mm-hmm.
it will take me somewhere. So SOP very important. I reached out for recommenders again to be done early because these are people who are busy.
Yeah.
One of the supervisors in my school research work is right now the dean of students at the School of Public Health in Zambia. So I reached out to him. He knew me. I had worked with him. He was very happy to recommend me. He said, I'll do this. I reached out to my supervisor at the hospital. He said, I'm going to recommend you. And some people that I had worked with. I did it early, and they told me to tell them the overview of what I've done so far, what they might not know, which I have done. So
Yeah.
I gave them all the information. This is what I'm doing. These are my ambitions, and they had to craft those recommendations. Of course, CV, curriculum vitae, I crafted it. But as I said earlier, the SOP is the most important because it talks about your story. Who are
Yeah.
you? Why are you applying? How does your journey of life, your academic journey, fit into public health program? Those kind of things.
Mm-hmm.
So
Mm-hmm.
after doing my CV, what else did I do? WES evaluation. I remember that one. For my school, the University of Zambia, it was easy because some people have done it before. I went to my school. I told them that I'm doing WES evaluation. They told me, go and do SOFA's application. There'll be a prompt where you have to put in the school name. Then they'll send us a link so that we are able to send you your results. That's
Yeah.
exactly what I did. But I did them early and I followed your advice word by word and I became successful.
Awesome, awesome, awesome. So SOP, recommendation letter, CV, West evaluation, and of course you have to have an account on on the Sofas platform. And you
Exactly.
did mention something like very, very important: the issue of recommendation letters. The fact that when you reach out to potential recommenders, you have to give them some leads, what you've done, what you're expecting them to, to highlight, and all those things are extremely important. And the element of SOP, most SOPs, if I'm reading your SOP and I read the intro, I can tell whether you are a strong candidate or not. So, as you said, you know, perfecting the hook or the intro is very critical.
That's
So
right.
I think that you've given us a very good overview of your the application experience. How many schools did you apply to in total?
I applied to actually three schools: Johns Hopkins University, Columbia Mailman School of Public Health in New York, and Harvard University. And I got accepted in all of them.
Awesome. Mm-hmm.
I
Mm-hmm.
actually got scholarships as well in all of them.
Yeah.
Very good scholarships, very
Yeah, we
good
will,
scholarships.
we will talk about why you chose Hopkins, but for now, looking back, what would you say was a single best tip you would give someone applying to a top MPH program?
Crafting the SOP as best as you can is very important. You
Mm-hmm.
see, I believe, Dr. Banda, that people who apply at Hopkins or Harvard or Columbia or Emory, all of them are awesome candidates. They have good grades to
Yeah.
begin with. Good grades, that's a common denominator. Everybody has good GPA. But what makes you different? What makes you stand out It is your story, your experience, how you are able to link your experience, whether professional, your academics, to the program that you are going to do. That's pivotal. That's great. So the SOP really, it is one single thing I believe that differentiates those who are going to get admissions and scholarships and those who don't. And there you are simply explaining who are you. Why should they care? Or of
Mm-hmm.
course, you are Murishi. So what?
Yeah.
You understand, right?
Mm-hmm. Mm-hmm.
So what? I was at medical school. That's not enough. So what? So many people have been to medical school.
Mm-hmm.
So what? Oh, I've worked as a medical doctor before. I mean, so many people have been medical
Yeah.
doctors.
Yeah.
What is
So
it about your story, about your academics? What is the purpose of your life? Why do you
mhm.
want to do public health? Is it something you just thought because you watched Dr. Banda on a webinar, then you say, I also want to do public health?
Mhm,
Or
mhm.
there is something that really is driving you to do this? I believe those are the reasons, I think the solid foundation for an admission, because other things are equal. You're a medical doctor. Another person from Ghana is a medical doctor. You've worked with COVID patients. Everybody else almost has done
Yeah,
it.
yeah.
But what makes you different? So
Mm-hmm.
SOP to me is number one because that's where you explain yourself. You give them reasons to feel that we need this guy. This is
That's
this is
true.
this is a candidate for a number one school of public health. I think to me, the SOP is number one, and that's
SOPs.
why
Yeah.
people should visit again. I refer them to your resources. If you are watching me and you are applying this year, go on YouTube, watch Dr. Banda giving the anatomy of the SOP. Please do that today. Watch that video 10 times, 20 times until you are confident that you have written a very competitive and very excellent SOP.
Yeah. I mean, you've said all. It comes down to the SOP. The differentiating factor is SOP. Most of the people I've worked with initially they applied, they were not successful. They reach out to me. We put in a strategy. You can see that the main gap was their SOP because they had almost everything perfect. So as you've said, that is rightly true. Now, when it comes to making your decision, I know you got admitted to Harvard, Columbia, and Johns Hopkins. Uh, why specifically did you choose Hopkins?
You see, Dr. Banda, I'm a football fan and my team is Real Madrid. Why do I
Mhm,
support Real Madrid? It's number one. If you look at the track record of Real Madrid, they have got the biggest number of Champions League in the world. You see, that's a
mhm.
differentiator. You know, these schools I mentioned, I actually got like big awards. I'm telling you. Then you have Johns Hopkins versus the other. You see, this shouldn't be a very tough choice. I had said even when I applied, if I'm able to get admissions at Johns Hopkins, I won't think when should I respond. That's when they told me to accept my admission. It took me like is it 2 minutes or 3 minutes? I never thought about it. I said, this is Hopkins, admission came through. I just accepted. It was a reflex. You see? It
Yeah,
was a reflex. It's Bloomberg School of Public Health. What else do
yeah.
you expect?
Hmm,
To
hmm.
me, the track record of the school, I mean, I was expecting to really get into Bloomberg. So I had to reject these other offers. They were also good, by the way. Very
Yeah,
good.
yeah, yeah.
And they are
I
good.
remember I remember discussing my PhD offer with one of my mentors, and I was like, I've gotten admission to Hopkins PhD, and I've gotten admission to these other schools. What do you think? And he was like, you've gotten a fully funded PhD at Johns Hopkins, and you are second guessing. You are thinking about other schools. You better accept because that is the cream of the cream. So you
Exactly.
have to. So I know you are a Sommer Scholar, which is huge. I mean, Sommer Scholar is like when you're at Hopkins and you're a summer scholar, everybody sees you differently, from students to faculty. Once you say I'm a summer scholar,
Mhm.
there's some level of impact, or there's
That's
some
right.
level of gravitas that comes with it. So, how did you first hear about the summer scholars program? Even before you applied, or during the application, what time did you hear about the summer scholars program?
So actually, initially I thought that when I apply at Hopkins and they pick me, I used to think there would be another application for scholarships. Actually, I was mistaken. But when I was reviewing the materials, the information which is given on the website, Bloomberg School of Public Health, that's where I discovered that there were some scholarships, such as summer scholarship and other, other partial funding which are provided. And surprisingly, the information on the website says there is no separate application for the funding. So once you apply for the admission, you have actually applied for the scholarship. So I was
Yeah.
very shocked. I was very shocked. That's how I saw it. It was on the website. Then I said I should sit down and do due diligence, because I mean, I'm from Africa, I'm from Zambia. I don't have money to play in the to play in the in USA. Even if
Yeah.
all my families on could combine, put the resources together, they can't manage to pay for me. I
Mm-hmm.
said I have to do this diligently because my application translates in either getting the scholarship or not. So I saw it on the website for Hopkins, of course.
Awesome, awesome. But so when after you receive your admission, when were you told you were a summer scholar? Because for me, I remember vividly when Professor Maridina West sent me that email that congratulations, you've been selected as a summer scholar. It was a really surreal moment. So at what point were you told that okay, you've been selected to receive the summer scholarship?
It was February 13 on a Thursday. I'm in the hospital. I'm about to do an operation. I was about to do a cesarean section.
Mm-hmm.
Then something told me, some intuition, check your phone. When I checked my phone, I saw a name, Marie Dina West. I started sweating. You know, the whole body, I started seriously. When I opened that email and I read it, wow, it was like excellent news. So
Mm-hmm.
something like that. I have some
Yes.
excellent news. I didn't want to read the details. I just looked at some keywords there. I read the summer scholarship. Oh my goodness. That was my best day ever,
Yeah.
ever. And guess what? I told a junior doctor who's already experienced, I told him, you know what? I can't do a Caesar. I'm so overwhelmed. Like, I can't even eat. I can't even eat. I'm so overwhelmed. So
Yeah. Yeah.
I didn't proceed doing the Caesar. I kept on reading that message, and belief was, hitting me. I was like, oh my goodness, did this happen to me? But it was real. That
Yeah.
message from Maridina West, it is like no other.
Yeah. That's true. I mean, that I still remember that email and how everything changed, because at that point for me I was nearly bound to go to Harvard, because Harvard had given me more scholarships. Like, the scholarship package from Harvard was more than what Hopkins had initially suggested. Then, all of a sudden everything switched, because I knew what came with the Summa Scholars Scholarship. So I know you've been there for at least a term, right? You've this is
Yes,
your
yes.
yeah this is your
This
second
is,
term.
yeah,
So
yes, yes, that's right.
yeah. So what exactly does the Summa Scholarship provide for you in terms of tuition, living expenses, blah blah blah? Or what do you get as a Summa Scholar at Johns Hopkins?
Wow, may I say that Summer Scholar could be one of the best scholarships in the world, arguably. I don't know about other countries, but if you have the most prestigious scholarship at the number one school of public health, it could really be one of the best in the world.
Yeah, yeah,
They cover the whole tuition. That's one. Tuition covered. Now you have other fees. You have other fees. It's not just tuition fees.
yeah.
All these other fees
Everything, health
covered.
insurance. Yes.
In other words, when you are a summer scholar, you have nothing to worry about money. That's the truth.
Yeah,
Stipend 28,000, which is dispersed in smaller amounts each 2 weeks. That's
yeah,
massive. That's massive. I will tell you one thing, Dr. Banda. The stipend we receive as summer scholars is bigger than the salaries I was getting as a manager in Zambia. Seriously. I mean, it's bigger. It's bigger than the salary I was getting as a medical doctor. It's, in other words, it's big, very, very great. It covers
yeah.
so much.
Mm-hmm, mm-hmm.
It covers a lot. It covers a lot. I've never paid a dime on my health here. Everything covered. I
Yeah,
think
that's.
it's a big package, so to say.
Yeah, yeah. I mean, yeah, it's one of the best. I can tell you that the experience alone.
Exactly.
And
Yeah.
so beyond the financial support, I know this is just barely your second term. What other events have you had opportunity to engage in, like networking, mentoring, additional resources? Have you had opportunity to meet your other summer scholars? How many are you in this cohort?
So we are. It should be 11. Yeah,
Okay.
we should be 11. 11 or 11 should be 11. However, I'm told there is a summer scholar who was should be from Gaza or somewhere in Palestine who wasn't
Okay.
able to who wasn't able to make it. So
Oh,
minus that one, minus that
okay.
one. Yeah, but we talked to him on a live video, and it was very touching to see a
Oh,
very
okay.
intelligent and talented person unable to come on time here. And I wish him all the best.
Yeah,
Yeah.
yeah.
So of course, the summer scholarship has enriching activities. Just a day ago, we were having a leadership program
Mm-hmm.
where they, by the and all these things are paid for. Okay,
Yeah.
they are paid for. So we had the leadership program where they do an assessment of your leadership style, how you do things, and they are able to tell you this is the kind of thing you do best. These are your strengths, these are your weaknesses, and this is what you should do. And your strengths, when you overuse them, this is what happens. And by the way, we were supposed to meet our Soma the other week, but he wasn't feeling well. We are meeting him very soon. On the program, we are gonna meet Dr. Fauci, and there are so many programs aligned there. Should be
Yeah.
next month. We are like going to DC for leadership activities. There are so many activities,
Mm-hmm,
so
mm-hmm.
many
That's
enriching
that's
activities.
often the fun part,
Exactly.
the tours you do, the regular meetings, and the lunch is super exceptional. So
Oh yeah,
it's
the lunch, the lunch. Yeah.
everything is perfect. But I mean, I know for sure that there are some other prestigious scholarships that oftentimes come with some element of string attached. So the World Bank scholarship, the uh, the the other scholarship, I think from the U.S. State Department, they all come with string attached. Are there any conditions or expectations attached to the Soma scholarship, or it is there's no there's nothing like after you complete your program, you have to return home, you have to do this, you have to do this.
Well, there is no condition. I think the only condition is be in class, get good grades. They don't even mention that. I'm just creating it, you know.
Yeah,
Otherwise, the only thing is you're expected to be in class, to be full-time student, but there are no conditions of you have to go back, you have to do this. I mean, it has no conditions really.
Yeah. Wow. Okay. All right. So
In your time, were there conditions in your
no, no,
time?
no, no. They are not conditions.
Okay, yeah, yeah,
It's one of the prestigious scholarships that covers literally everything, and there are no any conditions, like there are no conditions attached, no strings
yeah,
attached. So it's like
yeah.
one of the best. I want us to talk a little bit about your experience at Hopkins itself. I can see like maybe you are currently at Hopkins. Um, you know, what was your initial experience when you got to the USA? If this was your first time, and what was your experience for the first time you got to Hopkins?
So I'll start with my first experience in USA. I was really surprised by how friendly people are in this part of the world. Like people are very friendly. They are very social, ready to help at any time. I think something that I loved. And so the most a lot of surprises, I saw them at Hopkins. You see, there is this day I got lost. I was going to medical school, and I didn't really know the direction of medical school from Bloomberg. Like I had forgotten because I had just come from orientation. Then I met a professor along the road. He's asking me, "Is everything okay? Are you looking for something?" That's a professor.
Yeah.
I tell this professor I'm looking. I don't know the direction towards School of Medicine.
Mm-hmm.
The professor stops what they are doing. She escorts me to School of Medicine, to the office of the person I'm looking for.
Mm-hmm.
I said, "Oh, I've never seen this before. I mean, like a professor, you're even escorting me." I said, "Where I come from, this doesn't happen."
Yeah. Yeah.
You have got people like Marie Dina West. These are people who've been teaching, professors for like 30 years plus.
Mm-hmm.
But the way they are able to relate with students, you know, caring people, humble people. I had never experienced this until I was here. It was very humbling, and it actually made me think that maybe I have to adjust what I used to think was right in my country. It wasn't right in the
Yeah.
beginning. And,
Mm-hmm.
and I'm really learning how to be a Dina West, how to be a Hopkins person, humble
Yeah.
people who
Yeah.
are ready to help anytime. This is a wonderful environment,
Mm-hmm,
really.
mm-hmm. That's true. I agree. I mean, the difference that is one of the main differences in academic setting. That how students relate with faculty. It's
Yeah.
one of the main differences. You've started classes. First term is over. How is it going? How
Wow.
if you had to describe the academic experience in one sentence, how would you describe it?
I do tend to believe that here we are using a different clock because the way time moves, it is so quick. Before you know it, 1 week is gone, another week is
Yeah.
gone, mid-term, term is over. It is so quick, very quick. Oh my goodness, I've never had it this way. So what happens here is you have so many assignments almost every time. You have to be writing something. You have to be engaged. You have got discussion forums that you have to be responding to, and it's not hard really, but time moves very fast because there is a lot to do almost
Yeah.
every day, and so you feel like time is moving very quickly. Otherwise, the material is doable, and the surprising thing I've seen here, something called open book quizzes. Open book quizzes. I had never done that before. I mean,
Obviously, medical school, nobody will tell you to do open book
open
quiz.
book. At first, when I heard open book, I thought it was a mistake. Actually, I had to inquire from a professor. Open book, does it mean I can open a book or? He said, yes, yes, that's what we really mean. I was surprised.
All right. So let's talk. A little bit about what the future holds. So post graduation, what are the plans, or you haven't thought about it yet. You're experiencing. I know you have like 2 years plus 3 years of STEM. Um, so what what is your plan for the future post graduate school?
Yeah, so this country really, or maybe let me say, Hopkins is, I think it's a hub of the best public health leaders in this world, and therefore my plan is really to work with them during my STEM time to learn the best practices. I would tell you, Banda, I've visited a lot of countries in Africa, and our public health systems have a long way to go, including my country, Zambia. You know, our public health systems have a lot of things to learn, and I'm thinking that this country, of course, they have got their own problems, but we have more problems in Africa. I don't know
Yeah.
about Ghana, but in Zambia we have more public
I mean,
health
it's
problems.
it's it's, it's literally everywhere on the continent that
Yeah,
we need
we are still
strong.
having
We need to
cholera.
build
We are
strong
still
systems.
having
Yeah.
cholera in Zambia. Almost each other year, we have a cholera outbreak. You know, we still have infectious diseases, HIV, malaria, tuberculosis, and the burden is a lot. Of course, we've done some progress, but we still have a lot to do. I,
Yeah.
I want to get these best practices, this knowledge, and apply it in the context of my country. That's my biggest plan.
Hmm.
That's my biggest plan, to
Okay.
apply this knowledge in my country to strengthen our public health systems, because we still have a long way to go.
That's true.
Some other countries, cholera was eradicated 100 years ago. In my country, last year we had cholera. Think about it.
Yeah. Yeah. It's the same. I
Yeah.
mean, it's the same in Ghana. Occasionally, we will get annual cholera outbreaks from time to time. Okay, we are almost close to the end of our conversation. So if there's a student who is considering applying to graduate school, what would be your best advice to them?
So I'll have 3 points: prepare early, consult early, and make sure you apply early. This is the thing. I start with prepare early. You see, if somebody wants to apply at Hopkins, it's an example I'm using. You have to think in your mind. This is Hopkins, Bloomberg School of Public Health. This is the number one top choice in the world. You really don't want to send a half-baked application. You don't want that. You don't want, to waste people's time, because this is a serious life. Therefore, prepare, prepare, prepare. How do you prepare? I'll repeat what I've said. Go online, go on YouTube, search Dr. Banda Khalifa. Why am I saying Dr. Banda Khalifa? This is what I used. I can't prescribe what I didn't do. I can't prescribe what I didn't do. Go on YouTube, search Dr. Banda Khalifa. You are going to see the videos which will help you how to prepare the SOP, how to write the best recommendations. I mean, it is all there. It is all there. And this is
Yeah,
2025. Information is available. So
everywhere.
do not, people shouldn't make assumptions that I can do it on my own. No way. You need expert opinions or expert guidance like the one for Dr. Banda. That's in the preparation phase. Somebody should know how to craft the SOP and everything which is required. It is all explained, sir, in your videos. It is all there. I saw
Yeah,
everything in your resources. Number two, in preparation phase, speak to the professors, speak to your bosses, people you've worked under before, those recommenders. Tell them what you want to do and do it early. That's the key. Do it early.
yeah,
People are very busy, my friend. You see, people are very busy, especially a professor. Again, it doesn't have to be a professor. People who know you. Don't use a professor who doesn't know you. What does he have to write for you? It should be somebody who knows you, somebody who can write something down on your behalf that I know this person for X years. He did this and that and that. I can testify.
yeah,
That's the person you need. Who is able to speak on your behalf? Very important. Preparation phase. Go to your university, make sure they have done West evaluation before. There is actually a friend of mine in Zambia who applied last year, and he was shocked that his school is actually not part of the West evaluation. That was a big shock. And
Yeah.
he discovered that in November. He had 2 weeks before, is it 3 weeks before the closing of the application phase? You see?
Yeah, that's
How
true.
I wish, how I wish he did this research like in June.
Yeah.
You understand? Maybe his school would have applied to be incorporated into West evaluation, but it was 2 weeks away.
Hmm.
So
That's
his admission really, did not materialize. Once
yeah.
somebody has done all these things, prepare, make sure you reach out again, Dr. Banda.
Yeah. I mean,
Send him, let him review them. He's done hundreds of reviews. You write hundreds. I think it's thousands, Doctor. I
yeah.
believe it's
Sometimes I
thousands.
just want to be generous. I mean, you've said it all. You prepare early, research early,
Exactly.
reach out to people. You can. There's nothing wrong with reaching out to people.
Exactly.
Letting them get help you through the process. But if you have to pick one spot at Johns Hopkins, what is the best place for you to relax or to study?
Wow, I love the lounge on the ninth floor. Very good. The
Ah,
reason why I love that side on the ninth floor is you have got the cafeteria nearby, so you are studying with a view of the whole city in front of you.
yes,
I
yes.
like that view.
That was my
When you
favorite
go
spot as
hungry,
well.
you just get a snack nearby. I think that's the best spot for me.
Yeah, that's true. That's true. I used to hang out at the ninth floor like almost every day. Right after class, we all moved to the ninth floor to relax.
Exactly.
Yeah, yeah. So, well, thank you so much for making the time. I know I'll have the opportunity to meet you at Hopkins, maybe during one of your Summer Scholar events last year or last 2 years. I was invited. Last year I was invited. So hopefully this year I'll have the opportunity to meet you guys. So thank you for coming. I wish you all the best. Stay safe. Bye
Thank you
bye.
so much. And before I leave, I want to say two things, Dr. Banda. Number one, I thank you, sir. The reason why I am thanking you is I never paid for your materials. This is the truth. I never paid
Hmm.
for your materials. And by using them, I became a summer scholar. That's a big thing for me.
Yeah.
And you must be, I think I told you this last time, uh, after seeing how you are providing information, I started learning from you, even wearing my dress code. I started actually, I went, on your photos on Facebook, on LinkedIn. I almost bought all my suits according to your colors. Why did I do that? Why did I do that? Because I felt that you have something I can learn from. It is not too late to learn. And whoever is watching this, learn something from Dr. Banda. Please subscribe to his channel. Follow him on LinkedIn. Follow him on YouTube. You are going to receive information that will change you, that will transform you. You are going to receive instructions, and you are going to receive information that will be very pivotal. In America, information is king. Without
Yeah.
it, you'll be stuck. So follow Dr. Banda, get that information. I think, Doc, thank you so much. And I'm happy that I was able to contribute at least one or two things on this podcast. I'm so happy and a proud Summer Scholar, of course, MPH, MBA, following in your footsteps.
Thank you so much for that wonderful recommendation and endorsement. Well, I wish you all the best. Hopefully, we'll find time and meet and chat more about life and how things are in this part of the world. So thank you so much for joining. Take care.
Thank you, sir. Right, okay.